Did you know that 1 in 10 women worldwide are affected by PCOS? This hormonal disorder can impact everything from fertility to mental health. This is one of the most common causes of female infertility. PCOS is more than just a reproductive issue. It is also an emotional journey that requires understanding and support. PCOS, which is polycystic ovary or polycystic ovarian syndrome, is a complex endocrine disorder affecting women of childbearing age, characterized by increased androgen production and anovulatory dysfunction. The exact cause is unknown. However, it is known to have 3 main features, which makes up the diagnostic criteria. First is the menstrual irregularity. Secondly, evidence of clinical or biochemical hyperandrogenism, that is high levels of the male hormone. And thirdly, polycystic ovaries seen on ultrasound scan, that is fluid-filled sacs inside the ovaries containing immature eggs which are incapable of triggering ovulation. Now, these are the 3 main features, of which a person should have at least 2 of these to be diagnosed with PCOS. So a brief insight to what actually happens is that the anterior pituitary gland produces 2 hormones, the follicle stimulating hormone and the luteinizing hormone. Both hormones control ovulation. Now, the follicle stimulating hormone acts on the ovary to cause the growth of follicles, whereas the luteinizing hormone triggers the release of those follicles, which results in ovulation. But with PCOS, the follicles are many and then the eggs are immature. Now, these follicles become filled with fluid, so they become fluid-filled cavities, which are known as cysts. And because there are many within the ovary, so it becomes a polycystic ovary. And then it is a collection of symptoms that happen to the individual, so it is a syndrome, hence the name polycystic ovarian syndrome. There are risk factors associated with PCOS. There is the genetics, where research has shown that certain genes might be linked to PCOS. There's a family history, especially when it's present in first-degree relatives. Insulin resistance. Research has also shown that high insulin levels are associated with increase in androgen levels. Age, which is mainly seen in women of reproductive years. Overweight or obesity. Overweight and obesity leads to insulin resistance and as such will lead to increase in androgen levels. Low-grade inflammation. Research has also shown that people with PCOS have long-term low-grade inflammation that leads to polycystic ovaries that produce androgens and affects ovulation. The symptoms seen are irregular periods, hirsutism, that is excessive facial and body hair, heavy bleeding, acne, overweight, as up to 80% of women with PCOS are overweight or obese, male pattern of baldness, acanthosis nigricans, that is darkening of the skin around the skin folds, for example the neck, the armpits, and infertility, which is one of the greatest problems of women with PCOS. Once these symptoms are noticed, a visit to the gynecologist becomes necessary. There, proper history is taken, physical exams are done, and a series of tests carried out, including hormonal assays and scans. As for treatment, the exact treatment plan depends on the goal of treatment and the symptoms of the patient. Lifestyle modification are considered as first-line treatment. Dietary plans are put in place. Diets such as low-carb diet, more of vegetables and fruits, exercise and weight loss. As stated earlier, treatment is symptomatic. For example, if there is hirsutism, mechanical hair removal is done, combined oral contraceptives are given plus anti-androgens. Also, if anovulation is noticed or irregular menstruation, medications such as combined oral contraceptives are given to suppress ovarian androgen and to return cyclic menstruation. In case of hyperandrogenism, drugs like spironolactone, flutamide are given. In case of insulin resistance, metformin is given. Infertility, ovulation induction is done, or in vitro fertilization if that fails. Laparoscopic ovarian drilling helps to correct hormone imbalance by lowering the levels of testosterone and luteinizing hormone and increases the level of follicle stimulating hormone. I hope this gives an insight into what PCOS is and has empowered women to understand their bodies and to seek help when necessary. Empowered women empower women. Let us break the silence around PCOS and together we can turn the struggles into a story of triumph. If you found this video educative, like and share my videos and subscribe to my channel for more educative videos. Thank you.